Hello student. Today we will study about the general anatomy and anatomical positions of the body with the terminology used in the anatomy. So first we will know about the anatomical position. The anatomical position of the human body, it is this one is the anatomical position. This one. 1 minute. This one is the anatomical position of the body. This one. This one is the anatomical position of the body. Okay. So in anatomical position of the body, it is the standing erect, eyes looking forward, upper limb hanging by the side with the palms facing forward. The palms facing forward and the thumbs directed laterally outward. Thumb will be laterally. Okay. Next one, in the terminology, this is the supine position. Supine position. This is the lying supine or flat, and this is the prone position. Prone position means lying on the belly. Lying on the belly is the prone position. And next one is lateral decubitus position. That's one. Lateral position or decubitus position. The lateral. Okay. Next, in the anatomical planes and axis. In in details, we will study it will in the exercise therapy, but for the anatomy purpose, we'll know what are the anatomical planes used in the anatomy. First is the coronal plane. Coronal plane, it is the plane which cuts the body vertically into the anterior part towards the front of the body and posterior part to the back of the body. This is the coronal or frontal plane. This is the anterior portion. This is the posterior portion. Okay. Next one is the horizontal plane. It is the transverse or horizontal plane which runs horizontally, cutting the body into the upper superior and lower inferior. Here, this one is the superior. This one is the inferior. Okay. And next one is the medial plane. It is the vertical plane which passes in the midline of the body, dividing the longitudine into right and left half. This is the right half. This is the left half. Anterior and posterior. Okay. Next. Here. The terms of position. What are the terms position? Anterior. Anterior I already told. Anterior means anterior means front. This one is the anterior portion. This one. And this one is the posterior portion. Yeah. Behind the back of the body. And the next one is the superior and inferior. Superior means upward, superior, and this was the inferior. Superior is also known as the cranial, and inferior is known as the caudal. Okay. Next is median, or median means exactly in the midline. Is the called as the median. Exactly in the midline is called. You have to know this terminology for every lifetime. This terminology in anatomy, not only in anatomy, it is also used in the exercise therapy for the movement purpose. you have to study and memorize this lifetime. Okay. Now next one is the medial. Medial is nearer to the medial plate. Yeah, the hand. This is the hand. This side nearer to the midline is medial, and this side away from the midline is known as the lateral. Yeah, medial and lateral. And last one is the proximal and distal. Proximal part. What is the nearer to the root of the limb? Yeah, root of the limb is here. Starts from here. The upper limb starts from here. So the proximal portion will be the this one from shoulder joint to elbow joint. This will be in the proximal, nearer to the root of the limb, and the distal portion is the away from the root of the limb. This one from elbow joint to hand, it will be the distal portion because it is lies distally from the root of the limb. Okay, and the superficial and deep, you can see superficial and deep from here. Next one, towards the skin or the surface of the body, and deep is further away from the skin or the surface of the body. And internal and external, towards the cavity of a hollow organ is the internal, and this one is going to be the external. Okay. Next, and this one is the terminology used in the anatomy as well as in the exercise therapy. So next portion will known as the terms of movement. Terms of movement, it will also fall in the anatomy and exercise therapy, just like the terminology, other terminology, the flexion movement. Yeah, the flexion movement. Flexion movement, it is the movement which includes approximation of the two morphologically ventral surface by decreasing the two angle between the two parts. Okay, yeah, this one is the flexion. Anteriorly, when you upwarding the limb, that is the flexion movement, and reverse of the movement or backwards. Yeah, here backwards, reverse, that will be the extension movement. Okay, next, abduction and adduction, the movement which carry lift away from the midline. Away from the midline is abduction, towards midline is adduction. Okay. Next one is rotation. Rotation, two types of rotation are there. Medial rotation and the limb rotation towards the midline. Yeah, towards the midline and away from the midline. Towards the midline in medial rotation, from the midline is the lateral rotation. Last one is the supination and pronation. Supination and pronation is the only movement occurs in the first curve radio ulnar joint, where the rotatory movement occurring only in the forearm occurs. The what is supination? The radius lies parallel with the ulna and the palm of the hand faces forward. Yeah, palm of the hand, this is palm of the hand which is facing forward, and when the that is known as the supination movement. And when the palm of the face faces downwards, here palm of the face faces downward, that movement is known as the pronation movement. Okay, so next in your next chapter will be the joint, bones, cartilage and muscles. We will study in our next classes. Okay, thank you.